Okay, we'll take just one more question from the floor. No?
Good
Nandito na
afternoon.
siya.
Good afternoon. I'm Renzo Ginto, medical student and chairperson of the University Student Council,
Wonderful.
UP Manila. And I commend the team for taking the initiative in creating a positive vision of our people's health. And I think the clear message that this discussion would like to bring to our policymakers, our leaders, our future president, is that it's not just money, it's not just GDP or a good image in the international community, but most importantly, it is people's health that is the real nation's wealth. And in behalf of the young people of UP Manila and in the health sciences professions, I commit to supporting and giving our full participation in campaigning and in realizing our dream for health for all. Okay? And here comes my question, okay? I commend your efforts in analyzing the healthcare system of our country and the recommendations for local and national reforms. But I also wish to see if the panel considered the global forces, the external forces that shape our local and national health. Because we are all aware that our nation's health is actually dictated by certain global forces. You have your international organizations, you have your big, powerful countries that create policies and dictate the decision-making in the global community. And sad to say, here in our country, we have leaders who give in easily to the demands and the interests of the foreign countries. So my question is, what are your recommendations to our future leaders, or in particular to our next president, on how to address these external forces that shape local health and at the same time strengthen our healthcare system that is grounded on the principles of universal healthcare?
How do you fight the transnational pharmaceutical industry?
I think that basically what is needed is a sincere commitment to our people's health as a #1 priority, and then have the other considerations as second priority. I think because our voters are mainly poor, all presidents have said that their health policy is pro-poor. But the fact is, according to Professor Balisacan of the School of Economics, national policies have always tended to be to have adverse effects on the poor and have benefited mainly the politicians, the bureaucrats, the rich elites. So, as Dr. Flaviere said, it is policy expressed in action is probably more realistic than policy based on paper. I think this administration has said many times that it is pro-poor, and the Secretary of Health is trying very hard to pay attention to the needs of the poor. But one single policy has already negated everything, because their resistance to the reproductive health bill is basically anti-poor, because as shown in many statistics. It is the poor women who have 6 children. Rich women, they have 2 children. That's what they want. Poor women want only 2 children, but they have 6. So I think that the effect, a pro-poor or a sincere pro-people's health policy has to be expressed in outcomes.
Thank you. Please, go ahead, Dr. Melgar.
I think because one key element that we identified actually in governance is not just simply managing the health system, but leadership. And to protect people's right to health means actually protecting them against powerful entities. No, it can be the Vatican, it can be it can be big commercial companies, etc. But your leader, your Secretary of Health, should be able to say no, because he is protecting the public good, public health.
Thank you. Dr. Paterno.
I'd like to answer from a point of view that goes beyond the health, because I look at our people's health as being rooted in the basic underdevelopment of our economy and our society. And I'd like to go back to Chairman Fernando's observation. Why can't we compete economically at this time? Why is a Filipino door that we produce more expensive than a Chinese door? Why was it in the 1950s our economy was only second to Japan in Asia? And what had happened? What economic policies did we follow that led to our deindustrialization and that we can't even produce our own agricultural products? So what I would like to see in our presidential ball, aside from a universal health care rooted in a sound economic program that will guarantee national industrialization that is domestic-led, anchored on an agrarian reform that will create the domestic market for our national industrialization. And I think if we are able to achieve that, we will go a long way into improving the health of our people.
I cannot agree more. I think that is an excellent point on which to end this forum. Thank you very much, Dr. Paterno. This afternoon we had a chance to analyze the problems, the situation, and the possible solutions we can offer to the healthcare situation in our country today. In the continuing series that the university is sponsoring, along these lines, we hope to have a discussion on the economic system of our country, possibly the political system, which is so flawed, the legal system and the justice system, hopefully the educational system. We will be inviting you all to these forums in the current series. I want to thank our panelists this afternoon. And all of you, the stakeholders in the health system of our country, for attending this wonderful discussion. And I thank the university through President Roman for sponsoring this series. Thank you all, and good day.